What's up, guys? Today's video is another update about my life as an ophthalmology resident, so let's get started. Right now I'm doing one of my final rotations, so currently I'm working at the Pediatric and Neuro-Ophthalmology department. I've been working here for about 2 weeks so far, and I'm still new and fresh, but I enjoy it so far, and I would love to give you some insight about my experiences. Usually at our clinic, and I guess also at many other clinics, you are rotating to this kind of department when you're a bit more experienced resident, because it's considered to be a bit more difficult to interact with these young kids, to examine these young kids, and also to handle their parents. So before I rotated here, I was also quite concerned that this could be maybe a problem if the kids would not really interact so well with me, if they would not make life easy for me. I was thinking this could be a bit stressful. Furthermore, I was also a bit worried maybe the parents, they would be annoyed if something takes too much time, or they're scared about what we're doing with the kids or about the diseases. So this was a place, the first time where I was a bit more concerned, more worried about it. However, so far my experience are quite positive. I did not have so many bad interactions. Most of the time, gladly, it was really quite easy to interact and examine the patients, especially the kids when they are older than 3 years old. They oftentimes really make life very easy for me. They are already able most of the times to sit at the slit lamp and stay there quite calm, so I'm able to see most of the parts of the eye, of the anterior but also the posterior segment. So I was very relieved when I realized that most of the time I'm not so in big trouble, and it's actually quite fun also to see these kind of patients. It's a different kind of age group, and therefore it's also quite interesting to learn how the eye looks like for these young kids and how the differences are actually. When we're seeing really young kids, maybe 1 year old, a bit younger or so, then of course it's a bit more challenging, a bit more difficult to do the examination. For these kids, we oftentimes then need to roll them in a little blanket where they're kind of a bit caught, so they cannot work so much with their arms to make this examination nearly impossible. Of course, this is a bit challenging, a bit also hard to see, hard to handle, but it's just the only way to examine the patients. So therefore, I'm quite used to this right now, and I feel like it's only for the best of the child. And oftentimes the parents are a bit worried about this when they see this as well, but then we explain them what we're doing, and oftentimes they also a bit more relaxed then. Furthermore, we also need to use like an eyelid retractor, put this inside the eye to make it open, and then the baby oftentimes is screaming, but then we are able to at least do the anterior segment examination with a mobile slit lamp, and also the fundoscopy with a direct ophthalmoloscope. Oftentimes we also are able to use a little stick. In German we call it a Della, to also move the eye in every kind of direction, so we're able to see the different parts of the retina. So far I'm also feeling more comfortable to do this. I've done it a couple of times now and it worked quite well. So the progress is like always in ophthalmology quite fast and quite high. So all in all, my experiences were much more positive and much better than I imagined how everything would happen. The children do a quite good job to make life easy for me. The parents are also more relaxed, And yeah, so therefore I'm quite happy about my experiences so far, and I can recommend everybody to interact with kids in ophthalmology as well. It's not that frightening like you maybe think it is. Second, I also want to talk a bit about the pathologies. So for kids, of course, we see quite different pathologies than normally. Of course, the easier ones are the ones where kids just have these refractive errors like hyperopia, and then we just prescribe glasses. Furthermore, a few kids also have a disease called strabism, so where one eye is just looking in the wrong direction compared to the other eye. So not both are looking straight, but the one is like in a wrong direction. And then when the kid looks at different angles, it's quite the same in every direction. So that is something that has to be changed, has to be corrected, because for them just the brain part for this eye does not develop so well. So at the end, the brain kind of suppresses the vision from this eye, and that's very harmful, because then you're only able to see with one eye, and you're also not able to see three-dimensional. And yeah, that already excludes you from a few kind of jobs, for example, like being a pilot. So that's very dangerous and has to be corrected. Sometimes this is just caused by also refractive error that can lead to strabism, but sometimes it's because of the muscle, and then these patients actually need a surgery to align the muscles again, and therefore you're able to see a clear picture of something with both eyes. Besides that, we also have kids oftentimes with infection of the eyelids. So there we have to see if they have a preseptal or orbital cellulitis. These two diseases are quite harmful. So oftentimes patients then need to get systemic and local antibiotics. Sometimes they also need to get a CT scan to figure out if there's an abscess, and that then also needs to be removed. And here we also interact quite close with the Pediatrics department and also the radiology department. It's also a department where we see adults. So the patients that come to our department here are the ones that oftentimes have a trauma. So after trauma, they then have a fracture of the orbiter, and we need to see if there's some severe damage to the eye as well, like a rupture of the bulbus, a retrobulbar hemorrhage. And then we need to give them the appropriate treatment for this. Furthermore, adults also can have strabism. For them, it's a different kind of mechanism. Like I explained before already, in adults, the vision is already developed, so they're able to see good, usually with both eyes. And when they develop a strabism, this is often causing double vision, because the one eye is not following the other one. And then they just see everything double. Here, the causes aren't like for kids genetic or other diseases. Oftentimes, it's caused due to an pathology to the nerve, the oculomotorius nerve or abducens or trochlearis nerve. Here, this could be caused due to a microvascular infarction or trauma, a tumor, aneurysm. A lot of different pathologies are possible, and oftentimes it's necessary to do an MRI scan of the head to roll out the pathologies I just mentioned before. Usually we wait for at least 1 year to see if the strabism still exists then, or if it's getting better. And if it's still the case after a year, then we talk about doing surgery maybe to realign the muscles and the eyeball. All in all, it's an interesting new field. I enjoy the rotation here. I see new kind of pathologies that I haven't seen before. And it's quite fun to also interact with children. I think it's special. In most specialties, you are not seeing kids as patients. So I'm also positive and excited about these kind of experiences. Probably it's not the department where I would love to work for the rest of my life. I'm quite sure about this. but still I benefit a lot from all these things that I learned here, and I'm excited for all of the future things that are coming. Yeah guys, thank you so much for watching. I hope this was interesting for you. If you're interested in doing ophthalmology residency, or you're also an ophthalmology doctor already. Thank you so much for watching. If you're interested in knowing how my life as an ophthalmology resident looks like in other departments, check out the video up here. If you're curious about how much doctors earn as ophthalmologists in Germany or in other departments as well, in hospitals, check out the video down here. Thank you so much for watching, and see you in the next video.